If you think of healthcare as a big funnel, Upswing Health is at the top of the funnel. It's just a wide open on-ramp for anybody with an orthopedic problem. We take care of them, we filter them, we assess them, we triage and manage them. And then surprisingly, very few need to go to the emergency room, urgent care, or even to a physician office. My name is Dr. Stephen Schutzer. I'm an orthopedic surgeon. I went into practice in July of 1986. Over the course of the next 37 years, I've treated over 50,000 patients with a variety of orthopedic injuries and conditions, and have done over 10,000 orthopedic operations in my career. Upswing Health is a health technology company that my partner Jay Kimmel and I built 5 years ago. And we built it to really create the way orthopedics should be practiced, not the way it's being practiced now. It is a company that's built on rapid assessment, triage, and management for a very, very low price point. If somebody has, for example, an open or a compound fracture, they need to go to the emergency room. There's no question about that. But other than that, 95% of orthopedic injuries can be managed by Upswing. So we have a technology, we call it ouch logic, because everybody has an ouch moment. In fact, 1 in 3 Americans every year has an ouch moment. And what happens is then the user, the member, the patient goes onto our platform, fills in some simple demographics, and answers questions. And the questions are exactly the kind of questions I would ask you if you were in my office. I'd ask you, did you have an injury? Where does it hurt? Does it travel? How long have you had it? This is not just a bot that connects with patients. The first interaction is with our technology, immediately following which we connect with the human, our certified athletic trainers. Jay and I decided when we built the company that our frontline caregiver would be an athletic trainer. Certified athletic trainers are probably the most versatile, well-trained caregiver provider in orthopedics. They engage with the patient, they call them every 3 days, they form relationships with them, they engage them in their own care. That's priceless. 75% of our patients tell us that the next time they have an orthopedic need, they're coming back. 60% of our patients tell us that, you know what? If we didn't have access to Upswing, I was going to the emergency room or the urgent care. You saved me from doing that. We have a fixed price point. There's no surprise here. The individual, our patient, our user knows exactly what they're getting, and we take responsibility and accountability for it. If it doesn't work out, we keep with them. It's a very predictable and accountable and transparent company. I've been involved with the bigger picture of healthcare reform for over 15 years. It's just something in me, maybe it's my conscience, but I feel for patients. And healthcare is in a crisis. 20% of our GDP is on healthcare now, $4 trillion, of which 1/3 of it is a complete waste. You can literally flush it down the bowl. So Jay and I built this company, again, to custom create a pathway for patients, right? Where they have immediate access, convenient access, high quality and affordability, and most importantly, they can trust their caregivers. I chose not to be a life or death surgeon, like a cardiac surgeon. I like to deal in quality of life, give people their wheels back, restore their motion, restore their vitality, watch them come in with a smile 6 weeks after I fix one of their broken parts. That's what I love.